right. Hi, my name is Madison Dahlberg, and this is my presentation on the diagnosis of a patient using glucose determination, enzyme kinetics, and urinalysis. Our patient here is 60 years old. She is a Hispanic female of 5 feet and 3 inches. At the time of her visit, she weighs 185 pounds, and her blood pressure was taken to be 130/85. The symptoms the patient said she was experiencing include increased fatigue, no effect on her appetite, increased thirst, and high blood pressure. The normal range for blood pressure is 120/80. 130/85 is higher than that, so it's high blood pressure. The preliminary diagnosis based off of the patient's information would be type 2 diabetes, which symptoms include frequent urination, increased thirst or appetite, fatigue, weight loss or weight gain, slow healing wounds, high blood pressure, and high blood sugar. The symptoms currently congruent with type 2 diabetes in this patient is the presence of high blood pressure. The fatigue the patient is experiencing may be due to high blood sugar as well as the thirst. So we did a couple of clinical tests to figure out if diabetes is a good diagnosis. The first couple of tests we did were about glucose determination. The first test here is the glucose meter. We place a drop of blood on the test strip, and a measurement is given in milligrams per deciliter. The chemistry behind this is that the glucose in the blood will react with glucose oxidase and the oxygen in the air to produce gluconic acid and hydrogen peroxide. The hydrogen peroxide then is oxidized by a small amount of voltage generated by the meter, which then it gets converted to milligrams per deciliter automatically. The results shown here show 200, which is outside of normal range of 700 to 100 milligrams per deciliter. So this means that the results of glucose are high in the patient's blood. The next glucose test we did was using Benedict's reagent. We add some of the patient's urine to the solution to see if a chemical reaction occurs. The extent of the chemical reaction determines how much glucose was in the urine. The chemistry behind this one is that the copper in the solution will react with glucose in the urine to form a carboxylic acid and some amount of copper 1 oxide. The more copper 1 oxide present means that there was more glucose present to create this new product. The results here show it went from light blue to a cloudy orange. This reading indicates that there is about 2,000 milligrams per deciliter, which is way over what normal glucose levels in urine should be. The next glucose test we did was a reagent strip on the urine. We just added some urine to the reagent strip and waited a bit to see what reaction would pop up. The chemistry behind this one is that the glucose in the urine will do pretty much the same thing as in the glucose meter, but this time it reacts with horseradish peroxidase and potassium iodide to oxidize, and this causes a change of color depending on the amount of glucose. So the more glucose, the darker the color showing on the reagent strip is going to be. We can see here that this brown matches up with the 1,000 milligrams per deciliter, which means that there is a large amount of glucose in the urine. Okay, next we did some enzyme kinetics on the patient's blood. The first graph here is about creatine kinase, which is an enzyme that speeds up the reaction of creatine and ATP to create phosphocreatine and ADP. Abnormal levels of this enzyme may indicate tissue damage or tissue degeneration. To determine what the levels are, you take the absorbance over time, take the slope of the line, and the slope here is 56. This is considered a normal rate of creatine kinase. So that means that there is no tissue damage or degeneration happening. Because of that, this also means that the diagnosis of diabetes is not supported because this usually creates higher levels of creatine kinase than 56. We did more enzyme kinetics on lactate dehydrogenase enzymes. These enzymes are to speed up the reaction of lactate to pyruvate to produce ATP, or it does the opposite of converting pyruvate to lactate to conserve ATP. Abnormal levels of lactate dehydrogenase may indicate broken or deformed red blood cells. The results of this are similar to how you determine the results of the creatine kinase enzymes. Is you see the graph of absorbance over time. You take the slope, which in this case is 126, which is a normal level. So this means that the diabetes diagnosis is not supported based off of the patient's enzymes. The last couple of tests we did were on urine analysis. The first test seen over here is a protein test where you boil 8 milliliters of urine to try to form a precipitate. If one is formed after boiling, here you add acetic acid, you boil it again, and if a precipitate forms once more, that means the protein levels are higher than normal. Based off of this image, we can see that there is no precipitate after boiling it again, so this means the protein levels are normal. The next group of tests we did was specific gravity and pH region strips. Here we had urine to a strip and it'll react accordingly. We see here that the pH correlates with 4.5. 4.5 means that the urine is acidic, which correlates with the diagnosis of diabetes. Whereas we see here that the specific gravity is matching up with the 1.030 score, which is a normal range. So the specific gravity test does not support our diagnosis of diabetes. Next, we see an electrolyte panel that was conducted. The phosphate ions were measured in decreased numbers. This means that the level of this particular electrolyte is way down from what it is supposed to be at. And we can see here that decreased levels of phosphate ions may be part of diabetes. More urine analysis. So we did more region strips, but this time for ketone and bilirubin. The ketone is a product of fatty acid metabolism. High levels in this indicate that the body is unable to properly use up carbohydrates. And then bilirubin is a waste product of red blood cells and hemoglobin breaking down, which is usually excreted through bile and urine. High levels of bilirubin indicate that there is too much blood recycling happening, that the blood is getting broken down much faster than it is supposed to. So for ketone, we see that this matches up with the moderate levels, which is congruent with a diabetes diagnosis because of the impact on the body's ability to work with carbohydrates. The ketone levels are at levels of moderate, which is still higher than it's supposed to be. So this is congruent with our diagnosis of diabetes due to the body's inability of breaking down carbohydrates. Bilirubin is on a small scale, which still is considered normal. That is not congruent with our diagnosis of diabetes. The last urinalysis test we did was called an Eric's region test. This is to test for levels of urobilinogen, which should only be in small amounts of urine. High levels may indicate diabetes. In this region, the urobilinogen will change colors of the solution depending on how much there is in the urine. We see here that the color has not changed that much. That means that there is normal levels and does not match up with a diagnosis of diabetes. Overall, the results of the multiple tests we did, the glucose tests show that glucose levels are high in both blood and the patient's urine, indicating possible diabetes. The enzyme kinetic tests show that the CK and LD levels are normal. So this does not indicate diabetes, but it also helps us rule out other multiple medical conditions like muscular dystrophy, myocardial infarction, and muscle injury. The urine analysis we did shows low pH, low phosphate ions, and high ketone levels, which are all congruent with a diagnosis of diabetes. However, the urine analysis also showed that there's normal protein, normal specific gravity, and normal bilirubin levels. While this does rule out diabetes, it also rules out other medical conditions like liver damage and kidney damage. Overall, from these tests, we can see that the final diagnosis is going to be type 2 diabetes due to the amount of other medical conditions we were able to rule out with the tests and the amount of tests that were congruent with diabetes. So unfortunately, there is no treatment available to remove this from occurring. However, lifestyle changes are key to help keep diabetes at bay. Doctors may prescribe insulin to take regularly to regulate your blood sugar levels. It's important to adjust your diet and exercise to promote healthier functioning and to get that fatigue at bay, get higher energy levels. Drinking fluids is very important to cycle out the glucose in your urine and keep the thirst of diabetes at bay. Yes, so that was my presentation, and I hope you enjoyed. Thank you.